Hey y'all, it's Dr. Tiana. So it's about 4:30 in the morning on surgery day, and just getting up, kind of doing my morning routine, getting ready to head out in a few, expecting amazing things today. I expected a little perfect. I'll be up walking, and I'm praying that I'll actually be released today as well. So we'll see. Send all the vibes. All right, guys, still dark. We just are arriving at the hospital, and got my mom here and got my rider here. She's here, and we are we're heading on in. All right, so we've got 5:30 call, and I should be in surgery around 7 or 8. So it's a couple hours for prep, and then and we in this thing. All right, this back is gonna get stabilized, and I'm gonna be walking without limping. Okay, so that's what we're doing. That's what we're doing. All right, so it's gonna be an amazing day. Hubs is at home with baby. They're gonna get ready for school, and then he'll be here by the time I'm done. So dad's on the way, should be on the way. So yeah, got the parents here. We're just taking care of what we need to take care of, all right? So I'll try to keep y'all on the journey. Listen, I'm doing my best, honey, to keep y'all updated on this experience. But yeah, we're heading in. We're feeling good. We'll check in soon.
You all were so awesome and sending your love, your prayers while I was in surgery. One of my favorite was this video from my baby brother singing one of my favorite childhood songs. It just really lifted my spirits coming out of surgery and understanding just how much the Lord was with me. So I appreciate you all. It made all the difference.
Hey y'all, how's it going? It's Dr. Tiana checking back in. So we are 4 days from surgery, the spinal fusion surgery. Happened on Tuesday. It is now Saturday. For the first 2 days, I literally slept the entire time. Like, my phone was off. No real communication at all to anybody. And then they realized on Thursday I had to get a x-ray just to make sure that the stabilizing pieces that they put in were the way they wanted them. And they learned that the drain port that they had put in the incision to help drain the blood out had broken. So there was a piece about this long left inside of the incision after it broke. And so on yesterday, I ended up having to go back into surgery for them to remove that foreign object. We think, because I don't know how it happened because I was definitely out of it, but I was turning back and forth on my sides because one side would get numb after a little bit, and so just trying to get comfortable. And so yeah, it caused the little plastic piece to snap. But that procedure went really well. They said it was like 15 minutes. They were in and out, and they didn't have to reopen my incision to get it out, which is amazing. But I do have a really, really large incision. It's like half of my back. That they had to cut open just to make sure that they could see everything and do all the stabilizing work that they needed to do. So today is Saturday, and I'm still here because they weren't able to manage my pain after the second surgery. So believing that we will be out of here soon, but also again beyond frustrated because I learned yesterday from the surgeon that the orthopedic surgeon that she had actually put in an order for liquid pain relief for me after the surgery and after the first surgery, which was on Tuesday, and I find this out on Friday, that they placed the order and it never got filled by the nurses. So the nurse that I had on the first shift after coming out of surgery never gave it to me. So I had been suffering for 3 days without the appropriate pain medication and pain management. And it was only because my husband, my sister, my mom were here to make sure that they were asking all the right questions and advocating, because I was so out of it. Now, this is a whole nother conversation for a whole nother series, okay? But the public medical system is trash. And so I think, before this even, we were seeing private doctors anyway. But I do think that I'm going to be looking at other sources as well for future things, just because I don't like this big system. I don't appreciate their inconsistencies. I don't appreciate their lack of care and concern, and it's just quite troubling. So I've been pretty disappointed in that, and also frustrated because I still can't go home and see my baby yet. And so we are working tirelessly to keep his life as normal and consistent as possible. So we do FaceTime every day, and get to see his face, but he's still like, Mom, where are you? So just taking it easy, resting. I think physical therapy and occupational therapy are coming back again today to make sure that the procedure yesterday didn't cause my progress to be stalled, because they did have me up walking stairs, walking long hallways in the hospital. So I do have mobility and I can walk just fine, which is great. So as of now, surgery is a success. It's just that recovery that's been a little challenging, and then once I get home and get settled for a couple of weeks, then the plan is to consider the next steps for treatment. So additional treatment. So yeah, that's where we are. So I don't have much of encouragement for y'all today because I need it a lot for myself. But always believing and praying with you for the best as well. And we'll check in again soon.